have finished talking about the girdles and bones of the upper limbs and the lower limbs, and it's about time we start talking about the axial skeleton. Basic information number one. When the fetus is inside his mother's womb, the vertebral column has one curve. But as the baby is born and develops, then the vertebral column will have curves. First of all, when the head of the baby gets bigger and starts to move, the baby will develop a curve in the cervical region, and then with increase in weight and then crawling and waiting, the curves will develop more. Collecting more information about the vertebral column requires looking at images, and this is something that we must do because anatomy is a visual and descriptive science. The question now is, what is the axial skeleton? The axial skeleton is made of several bones, and they form the axis of the body, and from top to other parts. The first part of the axial skeleton is the skull. Then we have the ribs and sternum. Then we need to know something about the vertebral column, and then the mandible and hyoid bone. The skull is the most superior part of the axial skeleton, and we're going to study it in the last PowerPoint presentation because it is a little bit needing more details. When we look at the vertebral column anteriorly, it should be very straight. Now, people have problems, and the problems will result in curved or areas of compression looking anteriorly. Now, when we look posteriorly, also the vertebral column should be straight, but looking laterally at the vertebral column, we are going to see several curves. These curves are normal. Now, let's look at the different regions of the vertebral column. The cervical region present in the neck, it is made of 7 cervical vertebrae, and it is convex anteriorly. Any part of a convex part of the vertebral column is anterior, it is called lordosis, as if looking up to God. Then next is the thoracic area, and it is made of 12 vertebrae, and anteriorly it is concave. Concave parts of the vertebral column are called kyphosis. Lower down is the lumbar region, which is made of 5 vertebrae, and you may notice that as you come down, the vertebrae get larger, and the lumbar area is in lordosis. That means it is convex anteriorly. Then we have the sacrum. The sacrum is made of 5 vertebrae which are fused together to form a single bone, in the pelvis. And then we have the coccyx or the coccygeal vertebrae. They are what is called the tail part of the vertebral column, and they are fused, and when fused they make a triangular structure, and we are not concerned about their number, and they are usually 4 or 5. Before we go into any details, we have to have an overview, because the vertebral column is rather complicated structure and we need to know basic facts in advance. Now, how long is the vertebral column? It makes 2/5 of the body height. And what is it made of? It is made of series of bones. What are these bones? They are vertebrae, and a singular is vertebra. Is that all what is the vertebral column is formed of? The answer is no. It is also having intervertebral discs connecting the vertebra with each other, and plus connective tissue. Lots of connective tissue are present around the vertebral column, and it has also many ligaments. Now, these structures we have just mentioned, they give the following results. They make the vertebral column strong, and strong does not mean fixed. It is flexible. It is strong and flexible. What does flexible mean? It means that the vertebral column has movements. What kind of movements can we see? It is forward movement, backwards, sideways, and rotation. Now, what is the function of the vertebral column? It protects structures like what? Like the spinal cord. What is the spinal cord? It is the part of the central nervous system present within the vertebral canal, and we are going to have an idea about the vertebral canal, and it is a site of attachment of course we have just studied that upper and lower limbs are not directly attached to the axial skeleton, but they do through girdles. So the vertebral column will receive the girdles of the limbs, and ribs are attached to the vertebral column, and many muscles are attached to the vertebral column, and it gives support to the head. This is an image of the 3 views of the vertebral column, and the top part holding the head is what is called the cervical part, because it is in the neck, and it is made of 7 cervical vertebrae. They are called C1, C2, and so on to C7. Now, the next few slides, we are going to go into the details of the cervical vertebrae. Now, in this image, we can see that this is what is called a typical cervical vertebra, and you can see superior part is the superior view, and the inferior image is that of the lateral view. When we want to go into the details of the cervical vertebrae, we go to the largest part, which is the body of the cervical vertebra, and it is the most anterior part. Looking down, the lateral view is rather confusing, so we will concentrate our details on the superior image. The first structure we talked about was the body, which is the most anterior part of the vertebra, and it is the most anterior. Then as we go posterior, we see a cavity or a big foramen in the vertebra, marked green. This is called the cervical vertebral arch. And the cavity or the foramen between the body and the vertebral arch is the foramen, the vertebral foramen. In this area, it is called the cervical vertebral foramen. Then, if we go more posterior and we start the body, the vertebral foramen, and then the most posterior part is the spinous process. What comes out of the body of cervical vertebra or any vertebra is a process which is marked green. This process is called transverse process. Now, there is something special about transverse process of cervical vertebrae, and that is it has a foramen, a hole for an artery to pass through. And if we look at the most lateral part, you can see two tubercles. One is anterior and one is posterior. Now, when we look at the green marked structure, this is a process that comes upward from the root of transverse process, and it has a facet. A facet is a smooth area for articulation, and this is called the superior articulating process. It's a process that is going to articulate with the upper vertebra, and of course it is going to have lower articular processes for articulation with the next vertebra. Now we have 7 cervical vertebrae, and the next question is, are they all the same structure? The answer is no, they are not. The top one, the C1, is going to have a structure adapted to have the skull sitting on it. This is the first cervical vertebra, and it is called the Atlas Vertebra. Is it special? Yes, it is special. Why is it special? Because it is going to receive the skull sitting on it. The skull has 2 condyles, and these 2 condyles, they need 2 facets to accept them and make a joint. Now, the atlas, The C1 vertebra is not a typical vertebra. What is a typical vertebra? A typical vertebra is a vertebra that has a body anteriorly, two pedicles, two laminae, and spinous process, and a transverse process, and superior and inferior articulating process. Now, the atlas is not having all these features. The feature that we can recognize very easily is that the transverse process is having a foramen. This is called transverse foramen, and this makes this vertebra cervical for sure. Now, where's the body? There is no body of the vertebra. The body has divided into two masses, and these two masses of bones are united posteriorly with an arch called posterior arch of the atlas. This is a lateral mass, one half of the body, and the other lateral mass is on the other side. This is also the cervical one, the atlas, and we have seen the two lateral masses. We have seen the transverse process with the foramen, and in the previous slide we saw the posterior arch, and the vertebral foramen is completed anteriorly with what is called the anterior arch, which is marked green. We are in the process of collecting information from the atlas, the first cervical vertebra, and we can see that this is definitely a cervical because it contains a transverse process with a transverse foramen. And where is the body? There is no body. It is divided into two lateral masses, and you can see that the red arrow on your right is going to receive the condyles of the occipital bone, and these are concave, and they are ready to receive the occipital condyles. And the arrow in the middle, this one, is a place where there is a structure which is going to sit here in this area, coming from C2, the axis vertebra, and the atlas and the axis will be attached to each other through this process. This is the atlas vertebra, and I will leave it to you to study it and try to extract as much information as you can. What is this? This is a cervical vertebrae. Why is it cervical? Because it has a transverse process that has a foramen. This is the transverse foramen, and it has a facet on its body to receive the atlas. And the question is, does C2, the axis vertebra, has a body? The answer is yes. And from this body, let's have a summary of the basic structures making the axis, the second cervical vertebra. First of all, we have the body, which is anterior. Coming out of the body is the axis or the odontoid process, which has a special relation with the atlas. Then we have on the body articular facets. A facet is a smooth area for articulation with another bone, and here is the other facet to receive the atlas. And then, of course, this is the hallmark of this vertebra being cervical, and that is its transverse process has a foramen called transverse foramen, and this part is called the lamina, the lamina of a vertebra coming out from the pedicle, and this is another lamina coming from the other side pedicle. And when these two laminae unite posteriorly, they give the spinous process. Now, the spinous process of cervical vertebrae is bifid, dividing on its posterior side. So this is the spinous process of the axis, the C2. This is the kind of connection between the atlas being superior and the C1 and the axis, the C2. The connection is in two parts. First of all, the lateral mass of the atlas is going to sit on the facet of the axis, and this one is going to sit here and articulate with it, plus this odontoid process or the axis is going to go to this place here and articulates with a special facet on the anterior arch of the cervical C1 vertebra. Let us review again the information you can get from this cervical vertebra. This is a typical one. It is not the atlas, it is not the axis. You can see the structure marked green. This is the spinous process, which is posterior, and it is bifid. And this is the main part, which is the body, which is anterior, and this is the transverse process, which is having a foramen. This is typical of cervical vertebra, and you can see that the transverse process has a posterior tubercle and an anterior tubercle, and then coming out of the body is part of the vertebra called the pedicle. There's a pedicle on the right and pedicle on the left, and this pedicle is going to give rise to this process, which is called the lamina, and then a lamina with a lamina of the other side, they give rise to the the spinous process of the cervical vertebra, and you can see that there is a depression in the middle of this spinous process, and it is called the Bifid spinous process of cervical vertebra. This is something you only see in cervical vertebrae. Please move the animations, and I will leave this slide for you to practice your extraction of knowledge from this image. This is also an exercise for you. Everything is labeled, and just go through it step by step. And this is not labeled structure, and you need to find the very characteristics of cervical vertebrae. Going down from the cervical region to the thoracic region, and they are termed T1 for thorax to T12. There are 12 thoracic vertebrae, and you can see that in the anterior and the posterior vertebral column view, these are straight, but when you look laterally, you can see that thoracic vertebrae are concave anteriorly and convex posteriorly. This is a thoracic vertebra, and you can see that here is the body. This is a lateral view, and you can see this is the body, and then from the body you can see that there are two facets, one superior and one inferior. These facets are for articulations with ribs, something we did not see in the cervical region. Then we have a superior articulating process that has a facet facing posteriorly to receive inferior articulating process of the above vertebra. And then you can see the pedicle coming out of the body of the thoracic vertebra, and this is the transverse process of thoracic vertebra, and it has a facet for articulation of the rib. So the rib comes from this facet, articulating with it, and then comes and has a tubercle that is going to articulate with the transverse process. Now, so the articulating facets on the body are very special for thoracic vertebra. The very specific for thoracic vertebra also is that the spinous process is directed downwards. This is very special of thoracic vertebra. This is a thoracic vertebra, and we can see that first of all, transverse process had no foramen, and then we look at the very specific feature of thoracic vertebra, which is the spinous process is facing down. This is very special feature of thoracic vertebrae. Which vertebra is this? Go to the lateral view down to your left, and you can see the spinous process is pointing down, and in the upper picture you can see that this green part is coming from the body, and it is called the pedicle. What vertebra is this? It is thoracic. Why? Because I can see that spinous process is pointed down, and in the upper image I can see that this is the body anteriorly, and from the body a lamina comes out. We have just seen in the last image, and then the vertebral arch is going to be completed by this green colored part, which is the lamina. And at this point between the pedicle and the lamina, two processes come out. This is the transverse process, and this is an articulating process with a facet, so that it articulates with the vertebra above or the vertebra below. This is the characteristic feature of thoracic vertebra, which is the green structure, the spinous process pointing downward. In a thoracic vertebra, we can see that the transverse process has a facet. This is a smooth area for articulation with the tubercle, the part of rib. Again, this is a thoracic vertebra, and the green colored part is the superior articular process, which has a facet to articulate with the inferior articular process of the vertebra above, and the facet is directed posteriorly, as you see in the lower image. In this view, we can see that the green colored area is the facet of the transverse process for receiving the rib, and the facet is directed laterally. Just posterior to the body, we have the vertebral foramen, bounded by the body anteriorly, and the arch posteriorly. What is an arch made of? It is made of two pedicles and two laminae. Now you can see in this view that the vertebral foramen is not blocked by green color, but the green colored structure is what? It is a facet on the body of the thoracic vertebra for articulation with the rib, and it's called here the superior costal facet, because there is another one which is called the inferior articular facet. The green colored area is a smooth area on the inferior surface of the body of thoracic vertebra, and it is called the inferior costal facet. Inferior because it is lower down, costal, a term for the ribs, and the facet is a smooth area for articulation with the head of the rib. What kind of vertebra is this? If we look at the body, most of the vertebrae have bodies, but if we look at the neural arch made of two pedicles and two laminae, so what? So many vertebrae have neural arches. But if we look at a facet on the superior part of the body of this vertebra, this is very special for thoracic, and it tells us that it is thoracic. Now, because this is a superior view, we cannot see whether the spinous process is pointing down or not. But we can see that the superior articular process has its facet pointed posteriorly. This is another feature of thoracic vertebrae. This is a three-dimensional image of thoracic vertebrae, but the most important thing is why this is thoracic. Reason number one is that there is an articular facet on the body for the rib, and the spine is directed downwards, plus superior articulating facets of the superior articulating processes are facing posteriorly, and the lower articulating processes have their facets directed anteriorly, and these are the features that make person identifies this vertebra as thoracic. Below the thoracic vertebra are the lumbar vertebra, usually termed L1, L2, L3, and L4 and 5. This is a superior view on your right and then a lateral view on your left. And this is the image of general features of lumbar vertebra. The body of the lumbar vertebra, as you can see, is large because the weight of the body and the vertebral column as you go down is increasing, so these vertebrae are starting to feel the burden of the weight of the body. You know what this green structure is? It is pointing lateral, and it is rather short and thick. You can see it is thick when you look at the image to your left. At this point, we know that the body is larger, the transverse process is shorter and thicker. Now, the green marked area is the vertebral foramen, and let us see next slide is the spinous process. Of course, it is pointing posteriorly, but if you look at the lower left image, you can see that it is a bit short and much thicker than any spinous process of any vertebra above it. Next special feature of lumbar vertebra is that its articulating process facets are directed inward, directed medially. That is of a very special feature of lumbar vertebra. The inferior articular process of a lumbar vertebra is pointing lateral. So the facet of the superior is pointing medial and the inferior is pointing lateral, so that they meet and connect these two vertebrae. This slide is labeled and it is a picture of a real lumbar vertebra, and it's important that you go around the image and extract the information that you can. After finishing with the lumbar vertebra, let's go down to the sacrum. The sacrum is made of 5 sacral vertebrae, but the special feature is that they are fused together. 2 images of the sacrum. The right one is a posterior view and the left one is an anterior view, and the green marked area is called the AL. It's just like a wing. Now, you know by now that the lower limb is attached to the axial skeleton by articulating of the pelvic girdle with the sacrum. So the sacrum has an articular surface coming from the ilium of the hip bone, and it is marked green in this image. Logically, the sacrum has to be articulating with the L5, the 5th lumbar vertebra. So the first sacral vertebra must have an articulating process, and it is a superior one to articulate with L5. In the lower left image, which is an anterior view of the sacrum, you have a prominence. You have a prominence of the body of the S1, and this is called the sacral promontory. Looking at the upper right image, which is a posterior view, you will find the spinous processes, which are almost fused together. Vertebrae in different regions have a vertebral foramen, and the sacrum has a vertebral foramen as well, and the lowest part is opened and it is called the sacral hiatus. The vertebral canal in all vertebrae have spinal cord, but lower down, lower than L2, the spinal cord ends, and we have spinal nerves that need to come out to the peripheral part of the body, and the sacrum has foramina for these nerves, and they are called posterior sacral foramina. Inferior to the sacrum is the last part of the vertebral column, and the area is called Coccyx. They are fused and they form almost triangular structure, and earlier they are either 4 or 5, and they fuse together to form a triangular structure. Vertebrae, as they are arranged one below the other, they articulate through articular processes, usually 2 superior and 2 inferior. But the question is, are the bodies of vertebrae connected together? The answer is yes. They are connected together by what is called intervertebral disc. This disc is made of outer fibrocartilage ring, and the inside is a jelly material called nucleus pulposus. Here you see that the outer ring of the intervertebral disc, also called the annulus fibrosus, it is made of fibrocartilage and not connective tissue. And this annulus fibrosus is made of several rings, are called lamellae, and the inside is the nucleus pulposus. Here is an CT scan image of the intervertebral disc, where you can see that the outer ring of fibrocartilage and the inner nucleus made of jelly material called nucleus pulposus. This is a lateral view of the lumbar vertebrae, where you can see in this magnetic resonance image called MRI, you can see that here is a disc which is not normal because it has a different color than the discs above, and lower down we can see that the annulus fibrosus of the intervertebral disc is teared and the nucleus pulposus is protruding into the vertebral canal. This image is telling me that the intervertebral area, in addition to having the intervertebral disc, it is also having several kinds of connective tissue fibers to make it strong. More ligaments are surrounding the vertebral column and attaching vertebrae together, not only around the body but around all articulating surfaces. Spinal nerves, the yellow colored structures, they come from intervertebral foramen. This intervertebral foramen is made of two parts: a notch in the pedicle of vertebra above and another notch on the pedicle of the vertebra below, and they make a foramen, and spinal nerves come out through this foramen. Look at the location of the intervertebral disc. If it is damaged and nucleus pulposus is protruding, it is going to make pressure on the spinal nerve. After collecting all this information about the vertebral column, there is an important step that we should do is we test ourselves if we have learned or not. And how do we do that? We do that with the most powerful thinking tool, a mind map. This is the heart of the mind map of the vertebral column, where you can see on your right that there is a subject of overview, and we have looked into this branch. Then the vertebral column has 5 regions, and when you go to your left, you will find that this mind map is also talking about the curve of the vertebral column, and then some information about intervertebral discs, and lower down parts of a typical vertebra. Now, what are the parts of a typical vertebra? The most anterior part is the body, and it has different shapes in different regions. Then the vertebral arch or the neural arch is made of two pedicles. The pedicle is a part coming out of the body, and it has a notch. One notch is superior and one notch is inferior. These two notches, when the vertebrae articulate, they form the intervertebral foramen, through which spinal nerve comes out. Then we have two laminae. They come out from the pedicle, and lamina plus a lamina, they meet in the middle line and they form the spinous process. Then in the body we have, plus the neural arch or the vertebral arch, we have the formation of vertebral foramen. So you may write down that a vertebral foramen equals a body plus a neural or a vertebral arch. Then we have processes coming out from different parts of a vertebra. We have two transverse processes, and they come out from the junction of a pedicle and a lamina, and we have one spinous process. This spinous process projects posteriorly, and we have two articulating processes, superior one and two inferior articulating processes and inferior pair. The vertebral column has 5 regions. The superior one is the cervical region of the vertebral column, and it is made of, then we have the thoracic region, the lumbar region, the sacral region, and the coccygeal region. Now, the cervical part of the vertebral column has 7 vertebrae. The first one is the atlas, and it has a different shape than other cervical vertebrae, and therefore it is called atypical, means not typical. Now, how is that? That is because it has no body of a vertebra, and instead of the body, it has 2 lateral masses which are going to receive the occipital condyles. Then the second cervical vertebra is called the axis, and it is different from other cervical vertebra, and therefore it is called atypical, not typical. How is that? Because it has a process projecting up from the body, and this is called the odontoid process. Then C3 to C6, they are having parts of typical cervical vertebra, and these features that are typical are, first of all, the spine is bifid, and the transverse process has a foramen. The transverse process has a foramen, is present in all 7. Now, the 7th cervical vertebra is also a bit different. In what way? It has a very prominent spine, and this you can feel it under your skin if you go and feel the back of your neck lower down. When you hold a piece of paper and you mind map these subjects, you will discover whether you know it or you don't know it.